a couple of slides. And my name is Ella, and this is Jasmine. We are clinical research practitioners based in the Children's Hospital at OUH. So we just wanted to speak a little bit about the role of the clinical research practitioner. And we have our colleague Leah has also sort of done the presentation with us, but she's had to go and see patients in an emergency this morning. So apologies, she is hoping to come a little bit later on, but yeah, see where she is with the patients. But yeah, do you want to get the slides on?
Hopefully that loads. Cool. I'm assuming everyone can see that.
Yes, we can. Thank you.
I think that's right.
Yeah. Okay.
So as Ella said, we're just going to do a presentation on our roles as clinical research practitioners, and me, Ella and Leah all work as Band 5. So this is like a non-registered Band 5 role, but some CRP jobs will start at kind of Band 4 with opportunities to progress to Band 5 or Band 6 as well. So we are Band 5s, but not all roles would necessarily be a Band 5. But for our roles, we didn't have to be registered to any bodies. So today we're just going to talk about a bit of like an introduction to our roles, our own kind of personal stories, so how we've got into our roles, some of our like main responsibilities, and kind of a bit of like what we actually do as part of our jobs day to day, some of the opportunities for career development, and then we'll have time to answer any questions or anything like that. So what actually is a clinical research practitioner, or a CRP? So the NIHR, which is the National Institute for Health Research, so that's kind of like a body that funds a lot of research in the UK, and also provides a lot of kind of the guidelines on running research in the UK. So they say that a CRP is an umbrella title used for a family of roles in research delivery that have a patient-facing element and where the post holder isn't currently registered to a healthcare profession. So CRPs work in lots of different research teams with lots of different other members of a research team, like research nurses. So we all have some kind of role in research delivery, which involves some element of kind of patient facing, but we don't have to be registered to any healthcare profession. Something to note is that CRPs can be known as lots of different names. So Ella and Leah are clinical research practitioners as their job title, whereas my job title is clinical trials practitioner. But there are loads of different kind of like variations. So like clinical studies officer or trials officer, I think is what they normally call CRPs in Wales. Clinical research assistant, trials assistant, assistant research practitioner, research practitioner. So like job titles might have lots of different names, but all kind of fall under that CRP umbrella. So that's kind of like quite important to know, I guess, if you're interested in getting into research and looking at kind of jobs. Just because something's not called CRP doesn't mean it's not actually kind of a CRP role. So CRPs can work in basically any specialty you can think of across the NHS. So that includes like research in lots of different like hospital-based specialties, so like neurology or cardiology, oncology, maternity or neonates as well. Primary care, like they have CRPs that can do more kind of GP primary care type research, mental health, and also public health. So CRPs can work in more kind of like social care, public health kind of areas. So yeah, any specialty you can think of, there will be some kind of research going on there. And CRPs could work with from kind of premature babies up to the elderly. So I'm just going to talk a bit about the kind of requirements or skills that would be kind of needed to become a CRP. So I've kind of summarized it into a few like essential skills and then a few more sort of like desirable skills. But first one I thought I'd mention is IT skills. So this doesn't necessarily mean like being incredible on a computer and being able to code or whatever, but you will have a lot of like send a lot of emails, and in my role we end up putting quite a lot of stuff on spreadsheets and things like that. So just like a basic understanding of like how to use like Microsoft Office, send an email, that kind of thing, nothing too fancy. And then being a team player is really important because CRPs work in a research team with other staff that are kind of facilitating research delivery. So that will include research nurses, data managers, coordinators, and also you have a lot of interaction with doctors as well, who are treating patients who are on your studies. So it's really important to be able to work as part of a team. Understanding of kind of like confidentiality, because CRPs will have a lot of the role will be involving like patient information, and handling data. So understanding kind of like basic rules around confidentiality when handling kind of sensitive patient information. This is the bit that's a bit more blurry, but I put either a degree or experience. So a lot of CRP roles will ask either for a degree in health or life science or an NVQ level 3 in health and social care. So some kind of like more academic pathway into it, or they will accept sort of experience in a healthcare setting as like an alternative. So just because you don't have sort of a degree doesn't mean that you couldn't become a CRP if you've worked in like a patient facing sort of setting. So that's kind of an alternative route in. Awareness of GCP. So GCP stands for good clinical practice, which is something we talk about all the time in research. And you would learn a lot about that on the job as well. But I think this involves a lot of kind of guidelines on things like confidentiality. So this is the sort of thing that if you were wanting to get into research, it would be really good to have a look at what GCP is kind of before, and get an idea of some of like what that involves. It's a good thing to sort of talk about. And then enthusiasm. So I think it's really good to be interested in the research you're doing, and also a lot of your role will be speaking to patients about research. So if you can kind of make that sound exciting, that really helps to encourage people to be part of research. And then desirable requirements. So obviously there's a range of other skills that will be really useful if you're interested in becoming a CRP. So clinical skills can be really useful. So tasks like being able to do ECGs or blood taking, observations, things like that. But this is something that's very role dependent. So the kind of patient-facing element to your role as a CRP will depend a lot on what sort of research you're doing. So, for example, you could work in a research team where you see a lot of cardiology patients and you have to do a lot of ECGs, or you could work in a research team where your patient-facing kind of element is more questionnaires and sort of speaking to patients, in which case clinical skills wouldn't be as necessary. But also these are all things that can be learned as well. So I think maybe not necessarily having those skills, but being willing to learn them is something that would be really useful. As I said about GCP and like awareness of GCP, similar to that, informed consent is something else that's really useful to have a bit of an idea of what that means if you were looking at getting into a CRP role. And this is the sort of thing that there are a lot of resources which can help with this. So at the end of our presentation, we've got some links to places where you can learn more about some of the things that we've mentioned if you're interested. And then leadership as well is a really good skill for sort of progression. So we mentioned CRPs normally start at sort of band 4 or band 5, but there is opportunities to progress into more kind of band 6 or even 7 roles with greater sort of responsibility, and a big part of that would be kind of leadership, so teaching others about your roles, or like management. So that's something that would be really useful as well. So then we were just going to talk a bit about how me, Ella and Leah all got into our roles in research. So a bit about my sort of path as into becoming a CRP. So I went to sixth form, and throughout my time at sixth form, I worked as a tutor in a local tuition centre. So I worked with children, and this is something that I continued throughout my degree as well. So that gave me a lot of experience working with sort of children and their families. And then I went to university in Exeter and did a master's degree in biochemistry, which I really enjoyed. I really enjoyed the sort of science, but I think throughout my degree, I realised I wanted to do something more kind of people-y, I guess, like more interaction with people, and to actually be able to sort of see the application of science to real life. So I kind of was looking for opportunities to get more involved with kind of patient-facing activities. So during COVID, I did a lot of volunteering in vaccination centres, which gave me some of that more kind of patient-facing experience. And then after I graduated uni, I got a job in a GP surgery, so I was just doing a lot of admin. But again, this was like quite a lot. It gave me quite a lot of experience of things like handling like patient medical records and the more kind of admin-y side of healthcare. And then I got the job which I currently work in, which is as a clinical trial practitioner. And I work as part of the paediatric hematology oncology team. So we do, we facilitate kind of delivery of trials and research studies for children with cancers and leukemias, and also kind of non-malignant hematology disorders as well, like sickle cell. And then do you want to do Leah's?
Yeah, one. Yeah, so Leah also during sixth form did some internships. So she did some immunology and like surgical internships. And that's when she really sort of thought that she like really enjoyed the research side of things. And then she went to university and also did biomedical science. And during that, she did some placements. So she did a placement as a data analyst in a cardiac rehabilitation centre. And similar to Jasmine, I think this was her experience throughout this was that she wanted to be a bit more patient facing as well, and she really sort of enjoyed it, but she wanted the more sort of interaction with the patients sort of directly, and she also worked as a research assistant, which was similar. It wasn't as sort of patient facing as she liked, so then she was looking at clinical research practitioner roles, because it's a bit more sort of mixed, so you do get some of that interaction with the patients, so that's when she found the role that she's currently in, so here in the children's research team as a CRP. So she works on mainly gastroenterology and surgery, and that's what she is currently doing. So yeah, she really enjoys it as well, and she knew that she sort of wanted to be in research, but yeah, less in the labs all the time, and less sort of in one place, as we do a bit of lab work, a bit of in the office, and a bit of on the wards and things. So yeah, it's a nice mix. So for myself, I did psychology at university, so wasn't as sort of medical, and then after that, I was a support worker. So once I graduated, I was first in a mental health hospital, so looking after adult males with sort of brain injuries and mental health issues, things like that. Then I was a support worker in a residential organisation, looking after children and young people with autism and learning difficulties. Um, and then I took a year off. But once I came back, I was looking at roles in Oxford, and I really enjoyed the work that I'd done. And for me, I'd had a lot of the patient-facing side of things. But when I found the clinical research practitioner role, I was really it was really interesting, but I didn't think that I was sort of qualified enough. I didn't think that I had sort of what I'd done so far like was enough, I guess, because I hadn't done sort of a sciencey, like really medical sort of pathway so far. I didn't think about that I could sort of get into research in this way. And I hadn't heard of the role specifically before. So yeah, when I saw it and saw that like I was qualified and I had all of like the skills and the experience, I went for it, yeah, sort of really glad that I have. But yeah, before this, I didn't know about it, so I think that's why I think all of us are sort of like want to sort of raise awareness for it, because a lot of people are in that position that they might not have sort of heard about it or know that that could be a possibility for them. So yeah, that's where we've sort of all come from. And I'll speak a little bit about the general responsibilities of the role, which can be quite difficult to sum up because, as you might hear us say, it varies between which sort of speciality you're in, which research team you're in, and which specific studies you work on. So it does vary quite a bit. So what we'll do is we'll go through sort of a day in the life of like my role and Jasmine's role, and then we'll speak about two specific studies as well, just to get a bit of understanding of what we actually mean when we keep saying, oh, well, it depends on the study. But generally, you will have all of the training that is required on the job. So we were new to research when we started the role, and we had a lot of training, a lot of e-learning, but a lot of yeah, all the training that we needed for the role on the job. And you will be trained up on the specific like responsibilities for each study as well. So you have to be delegated to the specific study in order to do the tasks for them. So yeah, you won't just be sort of thrown straight in, or you shouldn't be. But generally, so you do screening, so looking for patients that could be eligible for the studies that you're working on. So yeah, that depends where you're working, but looking through which patients might be eligible, seeing if they are, and then approaching, which is speaking to the patients or their families as well, explaining the studies, and then the consent. So informed consent, Jasmine spoke a little bit about, and making sure that they have all of the information, and if they want to participate, you then receive consent, so fill in some forms with them, and then the study specific visits. So this is where it depends on the study and what you'll do, and also the samples as well. So you might take samples, you might not, but sort of processing those as well. And then of course there's always some admin. So there's lots of sort of documentation and paperwork, making sure everything is very clearly documented, and keeping like the spreadsheets and things like that, and putting data into databases as well. And then sort of the training, which I spoke a little bit about, so you'll be able to get some training, and then throughout your career as well, you can always learn more. So keep doing any training, attend conferences, and that's where the professional development comes in as well. So you can yeah, depends on what pathway you want to do, complete sort of courses and yeah, further development. So we'll go through sort of might not be a typical day, but a day in the life of, so I work in the Children's Comprehensive Research team. So when I come in the morning, I would look on the wards and in the emergency department, and I would see what sort of patients have come in overnight, which patients are new, and if any of those are eligible for the studies that we are like actively recruiting to. So if I see that someone has come into ED this morning with like a condition that we have a study on, I would then go down and see the family and the child and explain the study to them. This is often, yeah, sort of more of a conversation, and yeah, they can ask any questions, and you'd give them some time to read some information about the study as well. And then if they like sort of agree to the study, you can receive informed consent at that point as well. And then any sort of study procedures. So one of the studies I work on, we might take a nose swab, and then you would organise to take some bloods as well. And then you have to store them in the freezer, and we might go up to the labs and centrifuge the bloods, so spin the bloods in the centrifuge, and then make sure all of the documentation is completed, collect any data. So often we have to go onto EPR, and yeah, collect any data that we need, put that into the database, write on the patient's notes as well, and then I might have a patient that has previously consented to a study that's coming in again. So they might have an outpatient's appointment that I know about, and sometimes we have to give like questionnaires every 6 months, for example. So if I have noticed that they're coming in for this appointment, I would go and see them when they're in hospital, and get them to complete some questionnaires, and then it's a busy day. I might attend a meeting about a new study. So studies that are coming in, we have to like set them up before we can start recruiting. So the people in charge of the study will have a meeting with us to run through all the specifics. So we might go through a new study that's coming up in our team. And then Jasmine, do you want to say about your day?
Yeah, so a lot of what Ella's mentioned is stuff that I would do as well. So things like taking samples and going to centrifuge the bloods, and attending sort of meetings to learn about new studies and things like that. Some things that I do in my job, which is in the paediatric hematology and oncology research team, that are a bit different to what Ella does, is I get to attend a lot of MDTs. So a lot of Ella's patients would come in more sort of acutely, whereas a lot of ours would be referred in and it's more of a process. So in order to sort of screen and identify patients who are eligible for some of my studies, we get to go to MDTs, which is really interesting and really good learning. A lot of the time I feel like I'm not clever enough to be there, but it is really, really good experience, and really, really good to learn. And I will communicate with the consultants as well, because ultimately they will be treating these patients, and a lot of my patients will receive treatment as part of a research study. So the consultants will have to kind of be happy for that to happen as well. I get to have a lot of communication with sort of pathology teams to get tissue samples. So a lot of, I think something that a lot of people don't realize about research is a lot of samples and things, we can just use samples that have already been taken. It's nothing extra. So for example, for some of my patients, they might have a biopsy and have this tissue which they get diagnosed on, and then they might consent to a study where they can send tissue samples off. So we can just use some of that tissue that's already been taken, so it's nothing extra for the patient. So we get to speak to pathology to see if they've got some tissue we can send, which again is quite a good experience. So I've had the opportunity to go down to pathology and see what they actually do with some of that tissue, which again, really interesting. A lot of the patients on our studies will be treated here in Oxford, but they will have what we call shared care at their local hospitals. So our patients can be from sort of Reading or Bucks or Swindon. So we have a lot of communication with their local hospitals as well to make sure that they're happy with supporting our patients who are on trials. So we get to speak to a lot of the nurses in our shared care hospitals. And another nice thing about some of the patients on our studies is some of them might have treatment for kind of up to 2 years. So they'll be on study for at that time. So we get to go and kind of catch up with them, do any sort of study specific visits. So give them sort of questionnaires at certain time points, but also we quite often will go and just chat to our patients to make sure they're still happy with everything, see how they're getting on, answer any questions they have about research. And we do what we call reaffirming consent. So if a patient consented to a study 6 months ago and they're in now, we might go and check they're still happy to be part of that study, and check they haven't got any kind of further questions. But again, that's quite a nice part of my job, to get to go and sort of catch up with families a bit later on when the child is doing a lot better, and kind of hear their experience of being part of research as well. So just as an example, we've got a few research studies that we kind of help deliver. So I think Ella's going to talk about one of hers.
Yeah. So yeah, we thought we'd give you specific like what the studies could involve. So this one is called the DEVO study, which is digital imaging versus ophthalmology. And this one is run by the neonatal research team, but I help out with the recruiting on it as well. And what it's looking at is congenital cataracts, so cataracts in newborn babies, and how best to screen for it. So currently they screen all newborn babies. Excuse me. They screen all newborn babies within the first few days, but they use a torch to try and look into their eyes. And it can be a little bit difficult. So an ophthalmologist, this is based in Cambridge, that was doing these tests, thought there must be a better way to do this. And she, with the help of a team, developed a camera that can take infrared pictures of the eyes, and it doesn't have any flash. And then we also get like a digital image, so we can sort of upload that, and it's clearer to see, rather than sort of one person at one time. And so yeah, we're currently sort of testing it compared to the standard method to see if it actually does work better, to see if it's accurate, and yeah, we think it might might replace the current method, but we need to test that out first, basically. So I go on to the wards and explain this study to the families, and yeah, have sort of conversation, answer any questions, and if they're happy to take part, they have the digital imaging as well as the ophthalmology. So it's like just an extra eye check for them, and they're already in hospital, so we can do it at the bedside for them. So I would guide them through the consent process, which for this study is online, so it's on their website, and we've left a link for the website as well if you're interested to have a little bit a look about the study. So yeah, I guide them through the consent forms, make sure they filled it all out correctly, and then I take the pictures so of the baby's eyes using the camera. It's called NeoCam, and then we upload these onto the computer, and any we would send any to a specialist that any sort of abnormalities or anything that we weren't sure about, we refer on to the specialists. And then also we have to sort of update our screening and enrolment logs, so information on who's in the study, and put that on the patient notes as well, make sure the copy is on there. So this is quite a nice, it's a relatively simple study, so it doesn't have any sort of follow-ups, or it's not like a complex study, but it could be really important if it sort of changes the way that we screen for cataracts. And yeah, as a CRP, I'm able to do sort of all of the sort of different parts of this study, and yeah, I've been helping out the NENOSA research team with that one. And then another one is funded by the NIHR, and as a lot of our research is, and so it's pediatric IBD bioresource. So this is a biobank study, which there's a lot of different sort of biobank like collections basically, and what they try and do is collect as much sort of like data and samples from patients, and then they have basically a big library of samples and information across lots of different like conditions, and also healthy controls as well. So this one's looking specifically at children with IBD, and so then researchers that might have a specific question can then use this like this resource as a way to answer their questions, instead of everyone getting thousands of different patients each time they wanted sort of a research question answered. They can use this as a resource, so it's really helpful to sort of sort of streamline that process, and not ask for people multiple times for different things. We can use it for lots of different studies. So this is the sort of collection of that, and making that resource. And so again, this one we would go to the parents and children, explain the study, explain what it meant for them specifically, and receive informed consent if they want to take part. And then we put the data onto the databases, and collect any samples. So if they have any sort of blood, tissue or stool, like collect any samples that went with it as well. And this one, but also a lot of research, is really important to work well with the clinical teams. So we try to sort of reduce the impact of research on the patients as much as possible. So if we want to take a blood sample, we would then liaise with the clinical care teams, and see if they were taking clinical bloods already. We would ask if we can do it at the same time, to prevent them having 2 blood tests, and so they don't have to come into hospital as much, sort of just for research. We try and sort of see them at their appointments or when they're already in hospital, to try and so that they don't have to come in loads. And so working with the clinical teams is really important to work that out. And like Jasmine was saying, when the sort of the treatments and the research are integrated, it's vital that you are both on the same page to deliver that care sort of together basically. And then of course there is some admin paperwork and things like that, and maintaining all of our documentation and things. But that is just two examples that if you're sort of interested and you're like, well, what do we do? You can have a look at those. Links are at the end as well, if you wanted to have a look. And then we will just talk a little bit about the sort of professional development, and like the opportunities. So this isn't you don't have to be registered to be in this role, but there is an option of a professional registration. So after you've gained some experiences, then when you apply for the registration, rather than a lot of roles you have to have done it before being in it. And it's relatively new registration in terms of compared to other, doctors and nurses, or so it's basically a way to try and become more of a recognised workforce, and sort of professionalise it a little bit. So I have recently got my professional registration, and that was after for me, I had a degree. So then after a year of working as a CRP, I could then apply for the registration. And I will just show you, this is the sort of pathways that you can go on for the registration. So the Academy for Healthcare Science is the organisation that hosts it. And so, as you can see, the one on the left-hand side, so I had a degree and then I worked for a year at practitioner level. Then I was able to apply to join the register. But if you don't have a degree, then it also takes into account like the experience as well. So if you've gained experience, it's sort of shows that it understands that that's very relevant as well, and you could be really experienced. You don't have to have a degree specifically, and so I recently got this registration, and you have to just sort of show that you're working at the right level, and you've got the right experience and things like that. But it is just to show that they're sort of trying to make the role of the CRP a bit more sort of known as a profession, as a professional body, basically. So that's like an option. It is optional as well, I should note. So it's an optional thing, and then it can also open a few more doors to go on to further development. So if you wanted to carry on sort of studying a bit further, some require professional registration. So it's a way to sort of open some more of those doors, basically. Do you want to?
Yeah, so I've talked a lot about learning about informed consent, GCP, that kind of thing. So a really good place, if you are interested in getting into like a research role, a really good place to start is NIHR, which again we've mentioned a few times. But they have a website which you can make an account on. Anyone with like a sort of NHS work email address can join it. And they have loads of kind of courses on there. So they do offer, I think, sort of like master level qualifications, but what's really useful is they have loads of like really short courses, to the point of like they have just like little 20-minute sort of courses you can do. And these cover sort of more general areas, like you can look at sort of leadership, inclusion, diversity, that kind of thing. But they also do sort of researchy ones, so like sort of introduction to like informed consent, introductions to like GCP, like capacity, informed consent for children, that kind of thing. So we've got the link on there, but that's a really good place, like I said, if you were interested in getting into research, and you wanted to learn a little bit more about some sort of research related things and find out maybe if research is something you would be interested in, that's a really good place to start. And they also offer like different sort of in-person opportunities as well. So different training courses that you can go on to learn about research. And that's something that whilst you're working as a CRP, you get to go to a lot of these different courses to sort of develop professionally. And these opportunities will vary obviously from like NHS trust to NHS trust, but NIHR is all across the UK, so they offer lots of training everywhere. And something else that we thought was useful is we've got a link to some case studies. So I think this was from a session, a sort of CRP session, where people were talking about their routes into into becoming a CRP. So there we've got you've got some case studies there, so you can read about like some of the different ways people have become CRPs and the different aspects of their job as well. So these are sort of really good places to start if you were interested in learning more about CRP. So that's kind of like all of our slides that we've got. We've got a bit at the end with some sort of links on there. So if you were interested, these are sort of places to start to learn a bit more about some of what we've mentioned and also learn a bit more about some studies. But yeah, and we're happy to answer any questions if anyone has any.
Yeah, we can send the slides around, and then if anyone has any questions now, feel free to ask. And generally, yeah, can give us an email as well. We're happy to answer anything.
This was a beautiful presentation. Thank you very much. Does anyone got any question before Nicola comes in?
Jayana, would you mind to stop recording for a second? Is that all right?
Yeah, sure.
Sorry, I have some questions, but